Health CS Cleopa Mailu just held a press conference at Afya House, and we now have Sheila Sendeyo speaking to us from there. Sheila, what do you have? What's the latest?
Well, there's been lots happening here during the day, plenty of meetings to try and come up with some sort of understanding and an agreeable solution to the stalemate between the health workers and the doctors, and as an agreement that would see the doctors and the nurses go back to work. But unfortunately, there hasn't been much coming out of it. There was a meeting earlier with the nurses union, but it was agreed that since the union is not recognized in all the 47 counties, that the recognition be signed within the next 1 week, and then they can take it up from that. There was another meeting between 4 to 5 o'clock with the doctors union, but also it didn't last very long. Not much came out of it because the doctors said that they can't negotiate after 5 p.m. So everybody's banking on tomorrow as another chance to try and take this forward, to try and come up with another step that will probably see the end to the strike and an end to the suffering of patients throughout the country. And as the CS said, everybody has to go home and sleep on it, and they will come back here again tomorrow from 8, and they will start it all over again. But there was a sense throughout the day, a sense of frustration, especially from the unions, that the government especially has had plenty of time to listen to them and to address some of their concerns that they have been raising throughout this whole period, but they haven't taken advantage of that, and that's why they went on strike today. And here in Nairobi, thousands of them, they marched first to Afya House and then to Treasury to deliver their petition. They're insisting on the implementation of the collective bargaining agreement that was signed in 2013 that would see them earn a 300% pay increase, and that's what they want. And they say if that's not done, then they will not go back to work, and I covered that earlier on. Have a look.
A rallying call for all the doctors serving in public hospitals to an indefinite work boycott. It is a bitter prescription for the government, now forced to find a cure for the sore relations with health practitioners in a dragged-out dispute over pay. The health workers had converged at the Public Service Club in Upper Hill, the first step of their journey to push for better terms contained in a collective bargaining agreement signed in 2013.
We have the capacity to escalate this strike.
Yes!
We have the capacity to escalate this strike. And this is only the first 5 minutes of the football game.
We wrote 3 letters to the Ministry of Health requesting them that we know that you are very busy dishing out tenders. So please, we are reminding you that the court gave you 30 days. We the Kenyan doctors. Those 30 days, nothing happened.
The doctors want a 300% pay hike. According to the agreement of 2013, this would see the lowest paid doctor take home 342,000 shillings, up from the current 40,000, and the highest paid pocket slightly over 940,000 shillings, up from the current 500,000 shillings. The contentious CBA covers a wide spectrum of issues, such as a review of job groups, promotions, deployment and transfer of medical personnel, as well as pay issues. Specifically, it addresses understaffing, with the government urged to employ at least 1,200 doctors every year for the next 4 years. The Salaries and Remunerations Commission recently released a report of a 17-month job evaluation exercise affecting civil servants and state officers, which includes all medics, but both the doctors and nurses unions have rejected it, saying it doesn't indicate what they should earn. And efforts to resuscitate the negotiations, it appears, are stuck in the waiting room. While government pleads with the health workers to go back to work, they say they will only go back when they are paid what is due to them. On the 6th of October this year, Justice Monica Mbaru had directed all the parties to the dispute to reconvene and solve contentious issues, including salaries, in 45 days. But according to the union, the government has not shown an interest in concluding the matter as had been directed by the court.
Behind the clash of opinions is a battle of wills. The doctors and medical practitioners say this is no damp squib. It will be long and drawn out, at least until what they bargained for in 2013 is implemented in full. Sheila Sendeyo, NTV, Nairobi.